African scientists were the first to identify and decode and announce the Omicron variant. The continent suddenly faced being shut off from other parts of the world. But medical practitioners also urging people on our continent not to panic. Joined now by Professor Thumbi Ndung'u, the Deputy Director of the Africa Health Research Institute. Professor Ndung'u, good afternoon to you and thank you for your time on the pulse. It was South African scientists that first announced the discovery of Omicron. There was shock, frustration and travel bans. Was that the right response from the rest of the world to our announcement?
No, thank you very much, Stephen, for having me on the show. Yeah, it is the wrong approach. It is not justified. It's not based on scientific evidence. It's really an outrageous decision on the part of most countries. So very disappointed that they took this decision. If you think about it, first of all, we don't have all the information regarding how, the nature of this virus. Genetic information is just that. It's genetic information. You need to do much more studies in order to understand the nature of the virus, and that has not yet been done. So I think it was premature, and I think it was uncalled for. And I think it is very sad in terms of global solidarity, in terms of fighting this pandemic.
There's a lot of work to be done to work out how different this variant is. And on one level, it has a high number of mutations. But we still obviously need to find out what that means for vaccines. It may be, and we may find, that actually in South Africa, where we have the highest proportion of vaccinated people on the continent, 35 to 40%, that we still don't have as bad a fourth wave as we've had a first, second and third wave. We don't know, of course, what's going to happen on the rest of the continent either.
Yes, and this is the information, the critical information that we need, and this is the research that we need. So there are three possibilities. There are three concerns, I think, around this variant. One is it could be more transmissible. The second thing is that it could be more virulent, meaning that people who get it become more sick. And the third possibility, of course, is that it could also be a variant that is better at evading immune responses. We don't know if any of those scenarios is going to turn out to be correct with this particular variant. And the nature of viruses in most cases, although we are all speculating because we don't have the data, is that when you see a virus mutate with so many mutations, the likelihood is that it gains one advantage and loses another advantage. So the possibility that this variant will be more transmissible and more virulent, in other words, cause more severe disease and be able to evade immune responses are very, very low. And so I think what we need to have is a calm response. I totally support the approach of not having travel bans. We shouldn't have travel bans. We shouldn't have lockdowns. We should just wait for the evidence to come out. We are almost 2 years into this pandemic, and we know what to do in order to deal with a pandemic like this. So this kind of knee-jerk reactions every time a variant is identified are completely wrong and unjustified.
I mean, it shows you how much work we need to do. It also means vaccinations are important. I mean, here in our country, we're actually sitting on stockpiles because people haven't been coming to get vaccinated. But the rest of the continent is in dire need, and the World Health Organization, as Secretary General made this point himself yesterday, the rest of the continent is in dire need of more doses.
Stephen, this is the most frustrating aspect of this, and very disappointing from my perspective in terms of South Africa, because in South Africa, unlike a lot of other African countries, we have the vaccines, we have the tools, the best public health tool to fight this pandemic, including this new variant, and that is vaccination. And yet we have stockpiles of these vaccines and people are not coming out to get vaccinated. So I think this should be a wake-up call that we need people to come out in large numbers to get vaccinated, because once you get vaccinated, you slow down the spread of this virus in the population. You reduce the replication rate and the replication capacity of this virus within the population, and the chances of variants arising becomes much lower. And it is very sad that people are not rushing to get these vaccines, whereas people in other African countries, in a lot of other African countries, would pay to have this kind of opportunity to get vaccinated. So people need to come out in large numbers to get vaccinated in South Africa. And we need to make sure that the vaccines are also available in other African countries. This is the only way to deal with this pandemic.
Professor Thumbi Ndung'u, thank you very much indeed, sir. Deputy Director of the Africa Health Research Institute.